To be here, and thank you, Sol, for inviting me today. I am an assistant professor of medicine at Vanderbilt University. I'm a cardiologist and geriatrician, but I have a real passion and love for trying to encourage healthy sort of practices and aging in older adults and keeping people really fit and with good quality of life. So this is really where my emphasis comes from. As Sol told you, I'm actually from England. And in England, medicine is a little different, as you're quite aware. But one of the things that's quite different about it is that there is a larger number of geriatricians in England, and there is a real sort of passion within medical health care there to really try to focus on taking care of older adults. And I think, you know, that comes through as far as most people who I meet who are geriatricians also have that, but it's a much more popular specialty there. I grew up in a very tiny little village, and it was a little bit like Miss Marple Village. Lots of little old ladies, thatched cottages, but it really started my drive and passion for taking care of older adults because I was really in a community where people valued sort of keeping people independent. This is our little village green, and then we even have signs in England about warning about, you know, taking care of older adults, and this is actually a true road sign. In most villages that you go to in England, they'll have around like nursing homes and areas where a lot of elderly people visit, they'll have signs like this to watch out. But most importantly, and every geriatrician that I meet has a passion because at some point in their life they had an older adult who meant a lot to them. And this is my grandmother on her 90th birthday, and she lived to 93, and she lived with us for 9 years, and she was pretty much my best friend. We talked about fashion, and even when she became blind, we listened to books together and read books together. And I think for people to really be passionate about older people is really to have that connection and have that value with them. So what I want to talk to you a little bit about today is really when and how does the aging process happen and what causes poor health. And then really to talk a little bit about successful aging and healthy aging. What's the evidence for that? What doesn't work? And then how can we achieve it? So all animals age, and one of my very close colleagues who passed away last year used to tell me that, you know, everyone thinks that aging is not inevitable, but it is. It's the only thing that's really inevitable. And we can do a lot of other things in our life, but we're all going to age, and people age in different sort of ways. And as adults, we know that our life expectancy in the US has actually increased as the years have gone on. So this is life expectancy from the 1900s right up to 1997. And this has improved in both men and women because of good hygiene, medical care, communities, all these sorts of things, reduction in infectious diseases, and now we're looking at people living to about their 80s. 75 to 80 is the life expectancy if you're born now. However, I will say that over the last couple of years, this is the first time that life expectancy looks like it may actually be declining from people who are born right now because of the epidemic of obesity and diabetes. So why is it important? Well, it's important because 3% of population are aged over the age of 65 in 1900, but now 3% of the population are actually over the age of 80, so that's quite a difference. We have a lot of older adults that we need to take care of, and approximately 35 million of them are over the age of 65, so that's a large number of individuals. But by 2030, that number will have doubled, and that's because of improved diagnosis and care from physicians for cancer and for heart disease, but also the baby boomer generation that we're looking at. So what causes aging? Well, we do know that genetics is really important. So if you have a parent who lived to an older age, you're much more likely to live to an older age. So genetics is very important, and there are a lot of theories about this, but we know that genetics are in. This is a picture from the New York Times in 2004, and this is 4 sisters, and there's something about this family that, you know, because they're all, one of them is 101, and they're all pretty physically looking great. I mean, I wouldn't mind looking like that if I was 101. But it's actually where you live is very important. So this is just a slide looking at the number of people at different ages. So as you go up, we're looking at ages on the right side. And as you can see, if you live in Nigeria, the likelihood that you have a high population of people in their 60s up to 80s is much less because people die of infectious diseases and all different things. But if you're actually in somewhere like Italy or a Western country, the population distribution is very different. So it's genetics and it's where you live. Is it inevitable? Absolutely. I just sort of talked about that. Scientists have managed to keep living cells alive for about 50 cycles, but then they are unable to keep them alive any longer. So no matter what we do medically, we're unable to stop the aging process. And it's actually only cancer cells that are immortal. So in some ways, you really don't want to have immortal cells, because that's hence why cancer is so difficult for us to treat. So there are some upper limits of longevity. Calculations allow us to estimate the effects of eliminating disease. So if I was to be able to sort of wave a wand and say, I'm going to get rid of all the cancer and all the heart disease thing, life would only actually be prolonged by 7 years. So even if you got rid of the two big factors that cause people to die, you'd only be able to prolong life by about 7 years across populations. And if there were no major diseases, all of them, this is how they've calculated it, then we'd only be able to prolong life for about 15 years. So no matter what we do in the medical profession, we're still going to have older people that we need to take care of. So the oldest, this is still the oldest human who ever lived. She's from France, and she died at 122 years. And she was actually still pretty feisty at that age. So this is actually the sort of the upper limit of age. But the spectrum on aging is actually quite different. You all know, I mean, I'm sure you either have parents or family members that are really debilitated in their aging years, and then you have other members of your family that may be really fabulous for their age. This is actually from the seaside front in England, this picture of these old ladies out taking a walk. And as you can see, I mean, I don't even know whether I could do that. But there are a lot of things that start to go. So the senses are some of the things that start to go. So hearing, vision, I think that's the most common thing that people seem to see. Most older adults wear glasses, may have hearing aids, but this spectrum amongst them is quite wide. And skin is one of the most obvious markers I think everybody realizes, and that's hence why there is so much money spent on cosmetics and Botox in this country, because people are trying to reverse those signs of aging, because they're one of those inevitable ones. As far as skin is concerned, keeping out of the sun is very important. Much reduced risk of cancers from that, and also the sort of connectivity and the collagen in the skin. I asked this question to the room that I previously gave this lecture. Anyone know where this picture's from? Yeah. If I give this lecture to any of my colleagues, they don't know that one. Okay, so down to a little bit of the nitty-gritty. So what happens? So mental aspects of aging, and I think when my patients come to see me, this is actually what they get most concerned about. So short-term memory loss, you have slower reaction times, and you have a failure to recall names that declines with age. And this comes, most people sort of have these sorts of issues. And that's a lot to do with inability to have good concentration later on, and just sort of the slipping of a few of those memories. However, insight and wisdom are supposed to be enhanced as we age, and I think that's one of those things that you get from sharing time with an older adult is, that sort of wisdom of a long life and experiences that, when you're in your 20s and 30s, you have no idea what life is going to hold for you. Alzheimer's disease increases with age, without a doubt, and actually in the next 20 years, dementia, primarily Alzheimer's disease, is going to be the biggest social and financial burden disease in older adults. So we've sort of been looking at heart disease for a very long time as the #1 killer, #1 cause of morbidity. But actually, because of aging and the ability for cardiologists and people in heart sort of care to decrease the incidence of heart disease and do better at taking care of it. But as yet, we have really no good medications or ways of protecting us from dementia. There really isn't anything out there. I quite like this one because it sort of reminds me of, so remind me, am I getting up or going to bed? So, I think people sort of, as they get a little older, have those things. Okay, so what are the diseases of aging that cause disability and poor health? Well, these are the top 4, okay? So these are things that nearly majority of people as they get age will be hit by one of these. So heart disease, #1 killer across the world now, because a lot of the developing countries are heavy smokers, aren't able to get medications for high blood pressure, all this. So #1 killer across the world. It's the #1 killer in the US and #1 cause of morbidity because of heart failure. Heart failure is very prevalent in the United States and it causes people to be in hospital a great deal. Stroke. Stroke is debilitating for somebody who has a stroke. Anybody who knows someone who's had a stroke, it's life-shattering for them because it takes away many of the functions that we know as our ability to just compete and be able to participate in activities of daily living. Cancer, I bet there's not anybody who hasn't had a family member or someone close to them who's had cancer, and then dementia. So these are the diseases, and they not only cause poor health, but they cause disability too. So what I like to think about is what is biological age. So I think we all have the number that we think about as, you know, our date of birth, and this is how old we are, but everybody knows people are very, very different. So I always like this quote, it's how old would you be if you didn't know how old you was? So that's kind of how biological really age is. It's really, you know, how old you feel. Someone who has severe arthritis and heart failure and many disabilities at age 65 is really not going to feel 65. They're going to feel 75. It's going to be much harder for them. In the same way, people who don't have that sort of disease burden in their 80s are going to feel very different. This is obviously, this kind of gentleman is very different. This is from the National Geographic picture, and this is a gentleman who was 101 years old, and he actually started water skiing in 1939, and there he is still water skiing. So he's a very different biologically old individual. And then here's some pictures of some, you know, how I probably would like to be once I sort of hit this age. This is obviously George H. Bush. This is some pictures from Japan, and then also some communities in the United States where people are sort of continuing to be very active into their old age. But what we really don't want to happen, and this is what I think a lot of older adults really are worried about, is this kind of sort of disease process, being elderly and being in the hospital and debilitated from that. And as you can see, this, I would like to say, is they're much more biologically older than the group of people that you saw before that. So what keeps you feeling healthy? Well, these are the things that don't work. So it's okay to take them. It's completely fine to take them, except for one exception, and I'll get to that. But there are a lot of marketing. This is big money. People love to think about keeping young, but there really isn't any evidence that any vitamin or supplement really, in a good scientific study, keeps you younger. There are lots of stuff out there, antioxidants, vitamin E, vitamin C, also. You may want to take them for other reasons, but they're not going to stop you from aging. Hormones. This seems to be a sort of really popular thing, and particularly the bioidentical hormones, and I always talk to my female patients about this in great detail, because I think there's been a real sway to go to clinics that will identically match your hormones and give you, it's the same hormones as the ones that the Women's Health Initiative told you to stop taking. They're still hormones, and they don't come without burden of problems. Heart disease, increased risk of breast cancer, those sorts of things. They're still estrogen-based hormones, and they may make your skin a little better and make you feel a little better, but they still are not without problems. And then I think I hear on the radio very frequently the cognitive memory exercises. So the evidence from that came from the fact that people who do crosswords or Sudoku or something like that are more likely to have better memory later on in life. So the thought is that if you participate in those sort of memory activities and cognitive tests, that you may be able to, you know, reverse some of the memory problems. But it's more likely that people who did those were more likely to have a higher level of memory and educational component before they even started. So it seems if you started off doing those and have done them through your life, it probably protects you a little bit, but going and doing sort of memory testing right now will not decline the amount of memory loss you have in older age. So I'm sorry about those, but what can we do about keeping healthy? So I focus on this just because it was a very interesting area. National Geographic actually investigated this to quite an extent many years ago, and they actually looked at the places where people live the longest in life. Okay, so they actually went to all these places across the world and said, where do the most people who live to 100 live? And they didn't just look for people who lived to 100, they looked at people who lived to 100 and were fabulous at 100. So a couple of different ones that for the first group was Okinawa in Japan, Sardinia and Loma Linda were all studied. And what they found was very, very interesting. So this is a picture from the magazine that shows a lady in Okinawa who, she's 102 years old, and as you can see, looks quite fabulous there. But what was amazing about her was that she was the center of their community. When people needed advice, they came to her. She had a focus. She had a purpose. So she was the center of the community. And this is not unusual in these communities. Older adults have a purpose. This is actually a picture from a follow-up article that was a lady who's 101. She's a Seventh-day Adventist out in California. There's another group of people who live for a long age. And she even teaches exercise classes. And again, had a real purpose in life, something to get out of bed for in the morning. And then family life. So in Sardinia, this is a picture from a family in Sardinia. I mean, I think it's very unusual to see United States families eat like this anymore, or even get close to it. So family life, community, it's a time where they would get around the table and share stories of the day, check on each other, make sure everyone's doing okay, and it still has that sort of family center. So the common findings across all of these groups of people were that they all had activity, okay? And the activity they had was not going to the gym and running on a treadmill for 30 minutes. It was doing something active all day long. So you get up in the morning, you walk everywhere, you park your car further away or you don't park. In Sardinia, a lot of these gentlemen in the evenings would go hiking into the hills before dinner was served. And just that physical activity, everything generally was active. You didn't get people sitting watching TV or all those sorts of things. Things were active. Family. Nearly every person has like a family that they're close to and are surrounded by, and sort of this, a real sort of family community. Majority of them had quite a healthy diet, and the healthy diet involved not a lot of animal fat, quite a lot of vegetables, a little red wine in some communities, but not a lot of carbohydrates, heavy processed carbohydrates. So they tended to have a lot of fish as well. So the sort of Mediterranean diet that we sort of hear about in Okinawa, they tend to eat a lot of, as said, fish there, but this sort of very healthy diet, and that was part of what everybody grew up on. And then I talked about this a little bit before, but nearly all of these communities had a daily purpose for all of the older adults. So majority of the older adults said there was something that they really wanted to get out of bed for in the morning. They had a reason to get up, they had a program of activities to do or whatever that they had. They had a reason for this day was important for them to be involved in. And then I think this sort of links into our sort of faith-based sort of area, is that nearly everybody, it wasn't one particular religion, it wasn't one particular kind of way of doing things, but everybody had some sort of faith and spirituality, i.e. this is not all it is. There's something more than just me. And I think that is something that's difficult to quantify, but I think it's a very important thing to think about, because I think it allows you to think about your actions and the way you're taking care of yourself as well. So the lessons to healthy aging, is really to, I said this, move naturally. So get up in the morning, park your car a little further away, walk up that, if you're going to go up 1 or 2 flights of stairs, take the stairs rather than the elevator, particularly going downstairs. I'm always having to bite my tongue when someone takes an elevator down 1 floor. Cut calories, but a small amount. It's very hard for people to cut calories. And I think, particularly when we go out to eat a lot in the United States and the plates are huge, but just cutting them down just a little bit every day will actually keep you. The only scientific evidence of reducing aging has actually been shown through calorie cutting in mice. So that's the only thing that's actually been shown to do that. Reduce animal fat and processed foods. There's quite a lot of evidence that very processed foods are so easy for the body to take up that as soon as the calories get in, they just kind of knock in there and get to all those fat stores. And we know that processed food also has a high, when you eat it, high levels of insulin right after that. And we know this is very bad for us, higher incidence of diabetes. And then the animal fat. Reducing animal fat reduces your incidence of cancers and of heart disease. We talked about personal purpose. I think this is really important, and I in some ways I can't emphasize this enough, that I think if you are living on your own and you don't have any sort of people coming and checking on you or being involved in social activities then there really isn't any purpose to sort of getting out and doing things and keeping yourself healthy. I'd say stand still. So this is sort of the moment of taking a chorus moment, or that moment where you can kind of just stop and take in the moment and slow down. And a lot of older adults involved in things like yoga and Tai Chi, which is very popular, is this sort of concept of taking a moment to stand still, take a breath in, get aligned with yourself. I think sometimes we sort of get so wrapped up into everything we've got to do that before we know it, we're sort of like a bubbling pot, and we haven't taken that moment to stand still for ourselves. Make family a priority. I think, when I go to work, I am always very, very conscious of the fact that my job is never going to hug me back. No matter what I do, no matter what achievements, my job is not going to say, well done to me. But when I go home to my little 3-year-old kids and they come running to me and, I'm the greatest thing that they ever saw, that's really important. So it's really kind of aligning, and I think in our environment where achieving is so big, but in a materialistic way, we forget about that. Taking time to eat dinner around the table, time to have, that non-television time. Be surrounded by the right people, and this is not just family. Individuals who spend time with people who have practices and goals in line with them are more likely to participate in those practices and goals. So if you, just like when you're a teenager at school, if you surround yourself with people who get in trouble, you get in trouble. If you surround yourselves with people who are active in sports and cycling and all those sorts, you'll participate in those. And again, the same way, if you surround yourself who have the same faith and spirituality as you, you're more likely to make a connection and a deeper connection on that level if you're around people who feel the same as you. And then that leads into spiritual community. I really do think that spiritual community, no matter what it is, that whatever faith you come from, whatever religion you come from, having some sort of, ability to share it's more than this kind of concept with other people and build strong relationships that way, and being able to kind of talk to people about that, I think that really sort of adds to it. And I know through my involvement in the church and that it really has been, an area that has sort of built me personally. So exercise, get to the fun part about it. Exercise absolutely has been shown to be beneficial. So these are a whole list of things, but I can't impress on you enough. And my patients that come to my heart disease clinic, one of the things that every single person gets referred for is physical therapy or rehabilitation or exercise. At any age, it's important. But what's really important is if I was to have an illness right now, whether I exercised or not would not have as much importance on my outcome as if I was 80 and to have an illness. So if an 80-year-old gets admitted to the hospital but they are a person who is very physically active, they are much more likely to survive it than someone who doesn't. So actually, as we get older, activity and exercise becomes even more important. But it does a lot. For us women in the room, it keeps our bones strong, it keeps the muscle mass up, it reduces our blood pressure, it reduces our cholesterol, and it reduces our risk of heart disease and stroke. So it also does a lot of other things, and these are sort of, these are more soft sort of outcomes to it, but it actually is the only thing in all the dementia research world that has actually been shown to improve memory. So there are several studies out there that have shown physical exercise improves your trajectory if you have dementia or have early signs of dementia. So, in summary, aging is inevitable. Healthy aging is more important than staying young. And taking care of your health is very important. I think every person should have a physician that they are able to bond with and have a good relationship and can, follow up with. Social interactions are unbelievably important. And then I say relationships with younger individuals. A lot of my older patients who are very involved with their grandchildren and great-grandchildren are much more likely to be physically active and very involved socially and have a purpose. I think it's sort of seeing that young life and spirit that's really important. Community, and then exercise. You are as young as you feel, and I was going to finish off with just suggesting some exercises, and that I give maybe for my audiences that have been a little older. Some of these are more appropriate, but so one of the things I always tell my patients is that once you lose the ability to do this, you are 40% of people are likely to lose an ability to participate in an activity of daily living. And what I mean by this is once you lose the ability to do that, in the next year, you're going to lose 40% of people are going to lose the ability to wash, dress, toilet, feed themselves, all those things that are just getting around. And I think when I tell older adults that, they're like, because their thought about not being able to wash and dress themselves is like, I don't want that to happen to me. So I talk to them about just doing, sitting in a chair and just raising yourself up and down. This is just a very easy activity you can do. If you get a little sort of doddery on the way up, you've got a chair right there to save you. So just those sorts of activities, strengthening these thigh muscles, really, really good. You can do them in your home. A chair is also, if you just by doing little bends, again, these kind of exercises are really, really good. And then most homes of an older adult have a walking cane in there. You don't need to sign up to go to some fancy gym or anything like that. These are just really, really simple activities. So something like this, you can even do, if you're not able to stand up, you can even do this sitting down, just lifting. Something like this, it has a lot of stability in it. Twists. Core strength and ability to keep this in function is really, really important as we get older. Ability to do this. This is core strength that actually improves the likelihood that you're not going to fall and have a significant accident falling. Again, you can use this sort of stick, something like this, just to do those bends. Again, if you don't want to use a chair, you can do these twists up on here. And then I actually always have, again, you don't even need to have weights in your house. I always tell people get a couple of cans out of the cupboard. These are ideal weights. They're not too heavy. They're not like the sort of heavy weights at the gym. You're not going to pull yourself a shoulder out or anything like this. They're really, really good, and they're just sort of more giving you a little bit of tension as you flex and extend. So you can just lift them up, do this kind of exercise. You can These are really fabulous for core strength and the arm strength, shoulders. Most older adults start to have a lot of problems with shoulders, and then when you fall, you're unable to kind of brace yourself against that. So these sorts of exercises up to the front. So just using simple things like this. The other thing that's always really very helpful are the bands, if you've ever seen them, the sort of stretchy bands, again, sort of pulling. You can tuck it under a door and use it to sort of pull up like this. So very easy, you don't need to go to a gym, you can do them in the home. And then one of the most important ways to exercise is actually walking. Walking, walking, walking. It's great. It gives you all your aerobic and all your sort of strength and stability training. Okay. And then, any questions? You can open to the floor. I'll take questions about anything.